Hello.
Dr. Green, welcome back. Robert is stuck in some traffic, and he's saying 6:10, 6:30 before he can log on. I'm not sure about Paula.
I'm not sure if it's me or you, but your audio is not very loud. All right, try again.
Can you hear me? Okay, enough?
I mean, yeah, it works.
Let me try something else.
So today we have Paula and
Robert for their final meeting with us. And at the end, I will be reading a citation from the mayor. And then next month, we will start with our two new board members, Melissa and Margaret.
So in terms of minutes, I'm not sure how to approve the minutes from last. I thought this might come up this month, but anyway, if I'm the only member, I'm not sure how to approve. You need two people to vote on a minute.
That's a fine point. We'll have to check with the clerk's office. Actually, I think probably we can get the minutes. Yeah, we can't vote on them until the next meeting. Let me check with the clerk's office how we can handle that. We may have to have a special meeting just to get them approved before the old members are finished at the end of this month.
Okay.
Yeah. Thank you for raising that point. It's a good question.
And I know, so we can't start until either Paula or Robert shows up. But I can bring up the last month's minutes, say attendance, and that don't list Paula, but then Paula closed the meeting, so I'm pretty sure she was there. Hey Paula. Oh, you're on mute. You're still muted.
Yeah, not anymore.
All right.
Let me turn my light on so I can be clearer. Okay.
All right. I mean, I know Robert's gonna be a little late, but maybe we should just get started. So 6:04, call the meeting to the order.
I second it.
All right. So you heard me, Paula. I think the minutes last time didn't reflect that you were here, so I think that's an amendment that needs to be made.
Okay.
Other than that, I don't have any emendations. So assuming that Paula's list is being attended, I make a motion to approve the minutes.
I second it.
It's just you and me.
Yeah.
All in favor?
Aye. It's going to be the last one, so we got to make it exciting after 2007, Brian.
I know, it has been a really long time. Yeah.
I can't believe it. I was like, all right with it, and then today I was like, wow, that's weird. But
2007, so
yeah, that's how long I've been on.
17.
It's only, 17 years. It was right. I think you were on 2 years before I had got hired, and then my father had a massive heart attack, got on. I don't think I could attend the first, and then,
I remember that.
I don't think the mayor knew what I was appointed. It was, like, legit not even 2 to 3 weeks after his funeral. He's like, "I'm so sorry." I'm like, "All right." But yeah, we've been through a lot, so I appreciate you, Brian, and being a part of it.
Yeah, thank you. All right, we'll talk more about that.
Sorry. I couldn't help it. I'm a softie.
It's all good. So we did the minutes, and then the next thing on the agenda is the Porter Street hearing. Should we do that?
Sure.
Nick is here, I see. And Bonnie, you're sideways.
She's straight. Oh, Bonnie is sideways, yeah.
I'm trying to fix it. I can't figure out why that is. I'm
It's all
so
good. Good luck.
sorry. I'll shut it off so it's not distracting at the moment.
Nicholas, you want to start?
Yes, to you, Mr. Chair. Just first off, I am gonna breeze through this pretty quickly and then set the stage for you. I've got a family emergency and I need to leave relatively quickly. So, with this one, we received the complaint from the occupant at 46 Porter Street, stating that the air conditioning was not working in the apartment. The inspectors went out to investigate the complaint. They did find that there was an air conditioning system that was not functioning at the place. It was determined that the way that the sanitary code is written, that it is a violation. The order to correct cited the incorrect section. It is supposed to be 105 CMR 410.35, and that the citation references the right section or the words where the owner's installation and maintenance repairs. The owner shall ensure that all items are properly installed, and then part of the owner installed optional equipment, air conditioners are included with that. So there was a ducted or inside HVAC system. It's not working properly. Our understanding is that it is cost prohibitive to repair it properly. The owner has requested to provide the option of doing window air conditioners. The occupant has said that they would prefer that not be the option and that the main system get fixed. And the reason why we're here is because at this point, we don't have the ability to make any further decisions. So the request to the board is to allow for a variance to either not require the air conditioning system as part of the sanitary code sections, or to allow for the window air conditioners.
You said or, but those are presumably the same.
No, the first option is to not require an air conditioning system be required at all.
Okay. And the second option is to not require it, but also authorize or encourage
window air conditioners as an acceptable
okay
option.
The documents that got sent to us, I read the letter from the owner, but the letter said that there were a number of attachments, and those attachments weren't part of the documentation that I saw. So things like so it's hard to verify the validity of things like the document about the lease saying, or whatever, the that it was never marketed as being an air conditioned unit, and that there was no statement about central air conditioning, and that the rent was appropriate, and none of those things could I verify. They were just attributions made in the original letter. Do you know?
I don't have those documents in front of me at the moment.
Okay. And I know you have an emergency. I hope everything goes okay, but do you have a recommendation for the board or any opinion?
Yes, our recommendation is that we wouldn't object to either option, just from a standpoint of it's not necessarily required as part of a health and safety issue. It is more of something that is optional if it was there. And our understanding is that the system has never functioned since the occupant is in the building. So there was never an expectation that air conditioning was being provided because the system never worked. It was always out of service.
Right. That's what the impression I got from the letter. But if it didn't exist at all, if this were a house built in 1720 and there was no air conditioning unit, then there's no variance, there's no required. The problem is that it was put in the first place, but badly designed. Do I understand that correctly?
Yes, that's what it appears to be.
Yeah. And again, I still have no way of verifying this, but from what I understand from the letter, it's not just that it's cost prohibitive, it's that this is part of a condo and the rest of the condo association won't allow other solutions. And so the owner is sort of stuck between having this unit that they can't use to function, and neighbors within the condo owners who won't allow the condenser to go on the roof and other such solutions.
Yes.
So there really are no solutions, assuming everything's true in that.
Correct. And again, I'm seeing if I can find the other documents that were sent in with this. I thought everything had been sent over. The owners here, maybe they have the documents.
Sure, I'm happy to let the owners speak. I don't, Nick, how I had to put you on the spot, but how long do you have to talk? Can you wait?
I got a couple more minutes. And I do. I'll take a look at this, and yes. All right. Looks like we have found the documents, so we'll be able to upload those into the.
Okay. Sure. We can give the owner 2 minutes to talk.
Hi. Hi everyone. Nice to meet you. So I do want to say something about the air conditioning, and actually I put on the letter. So these tenants were moved in 2020. At the time, I live in this condo myself since 2007 when I bought it, and I moved out to my condo, was rented in 2019 during pandemic to different tenants, and they left there. And then I found Alan and his roommate. And at the time when I installed AC, that was in 2015 or 16, one of my neighbors, that's a 3-family house. As long as one of the condo owner disagree to replace AC or something, we cannot do that. They disagree for me to put a condenser on the side of the house, which is an open place, so you can have the AC vent out. So at that time, my contractor suggested put it on the stairs of a ground level, but it's a closed space. The air doesn't really flow well. So I found once I started using that, after a little while, the air become hot. So it's never worked. So when I rent out to the first tenant, told them doesn't work, they're okay to use AC, window AC. And this tenant, the same thing. I never told anybody. So like in the lease, say we have provided central AC. I told them it doesn't work. Maybe you cool a little bit, it's gonna not stable. Don't rely on that. Use window AC. never had a problem. They lived here for 4 years. Each year they want to renew the lease. And this time they mentioned in May, they told me, they said, the central AC doesn't work. And also they cannot use window AC because there's not enough ampage for them to use. So I was surprised. I said, I know the window AC works because I use it, I used to live there. I use it myself. Even I have central AC, I use window AC myself. It works. All the neighbors use window AC. The three family in the whole building, we all wired the same way. There's never had a problem in shortage in electricity. So then they said, after that, I said, you must have, if you have a lot of equipment, that could be a problem because they have tons of equipment at home. So then they filed the ISD on me. And then at that time, the people, Victoria and another guy from the electrician department came here, take a look at my panel, said that there's no violation of code. Everything seems normal. There's nothing you could do about it. And then they said, okay, you have to fix the central AC. But I said, well, to fix it, there's few things. And I actually had several HVAC technician came to my house before, gave the same in conclusion. But because this time I got the order, I hired another different company, HVAC people come to take a look. It's not just money.
I'm sorry, but I did read the letter, so I know that.
Oh, I'm sorry. Yeah,
the
only reason, I'm sorry, I don't want to, yeah, I understand. Sorry about that. I was just thinking the two reasons I could not do things. One, the house, the house it was designed, right? The vent has come out from the floor and the condo was in the top floor. And even, he said, even you moved out to the side of the house, it's not going to work properly. And the neighbor disagree with that. The neighbor won't let me move the condenser to the side. And also the roof, according to the technician, is not suitable for this kind of condenser, and they not agree. So there's nothing I could do. So I said, maybe I can help you look into the panels. They said no. And their utility bill, they said not enough ampage, but their utility bill is over $500 a month.
Okay. I guess the only question I want, thank you. I did say that when I was giving my recap of my understanding, I just wanted to know if there was something that I got wrong, but it sounds like, I got the picture.
Yeah, you exactly got picture, exactly.
Okay. Thank you very much.
Thank you.
So, hello, Robert. You missed the beginning of this, but if you saw the letter, I think.
I read the letter. Yeah.
So I think you understand the basic gist and what Nicholas said, but he had to, I think, run because he had a family emergency. But what he said was that there's no clear health requirement why air conditioning has to be built into a unit. Basically, what happened is because the air conditioning unit was built and is in place and is now functional, it's not functional, it's in violation. But had it never been built, then it wouldn't be an issue in the first place. So essentially the two options that Nick laid out are to approve a variance that basically says that it's okay that it doesn't exist, or he said to say that the use of window units is an acceptable alternative. I don't see those exactly as opposites, because saying that the window unit is an acceptable alternative implies that it doesn't have to be built in the first place. But I think one is a more encouragement that the owner has to make a window unit a viable option and maybe supply it, I think is how that plays out.
But it is an option though, right? I guess what do you mean?
So it is an option that the owner has offered, and the tenants didn't want that option. They have reasons regarding electricity and electrical bills and all of that, but that's not a health department issue. So
No, okay. I'm just making sure I didn't miss
in my
anything.
opinion, that's not a health department issue.
No, not at all.
You know, Brian, and that thought had come up to me if this was the appropriate venue for this matter. you know.
Well, the reason I think the reason it's coming to us, I don't think it does anybody any service if we kick the can down the road. I think the reason it's coming to us is because there is a code that Nick invoked that basically says people who build these units have to make sure that if it's in place that it's functional. And I think in some ways my guess is, you know, having an empty space in a unit that like is a place where water can pool and then, you know, Legionnaire's disease can develop. Like you don't want to have an empty chimney that's not being used. You don't want to have empty space in a building unit. You don't want to have a non-functioning unit. So, but I don't know that us mandating that the ductwork comes out and something else gets built in places that to me doesn't sound like our issue either. But the real question is in the setting where this owner was led into believing that putting in this central air conditioning was a viable option, and then it turned out not to be afterwards.
Yeah.
What does one do? A, and B, also in this setting, if the tenants want something to happen that it seems like is impossible to happen, not both because of technical problems and also because the owner of the unit doesn't own the entire building and the neighbors in the condo unit are not agreeable to a solution, then the owner really is between a rock and a hard place.
Right. So where's your head on this, Brian?
Just not a Board of Health issue though, right?
I mean, it sounds like it is. It sounds like Nick has done the research and yeah, it's before us. So I think it's a matter of which of the two variances we'd be willing to potentially entertain.
That's right.
And I think in my view, with any variance, it's one of equity and fairness. If similar ones come before us, treating them like any that have come prior. You know, and I think the two options were the variance with no accommodation right to having AC, and the other one was requiring window units. Were those essentially the two variance options before?
Yes, except that Nick didn't say requiring. He said offering window units. That to me seems like the nearest approximation of the right answer.
Yeah.
If I'm gonna speak to what I think there are no options for central AC, and there's certainly no requirement that central AC is a thing someone needs to live in Somerville. So I don't think we need to make I'm comfortable with the variance saying that in the place of a building that is simply impossible to make a functioning central AC, it's okay to not have functional AC. I also think as a fairness issue, we can encourage that the owner make window units available. And if the tenant wants them, terrific. And if the tenant doesn't want them, terrific. That's their choice.
Yep. I think I'm aligned with that, Ryan. Yeah, if it's not feasible, she's done her due diligence. You know, Nick is on board with you know that option. I think that's okay with me. I don't know, Paul, if you have other thoughts.
Yeah, that's what I was saying. Like this, basically, yeah. What's presented is kind of not out of our hands, but it's just it is what it is. There's no big moving forward with this.
Okay, then I make a proposal that our board formally accepts a variance that in this building, I'm going to say for legal purposes, 46 Porter Street, that the central AC not be a required necessity of habitation for occupancy for the unit, and that window or air conditioning units be offered to the tenants.
I mean, I also think this is all in their like their lease and everything, right? So
Well, that was in the letter as well, that
yeah.
But
No,
the,
I
but
read
the
it.
lease
That's why I was
specifically said that it wasn't marketed, it's not being charged as
right.
a
So that's why I was saying like it's nothing really it's out of our hands.
Yeah. All right, I made a motion. Anyone second?
I second it.
All in favor?
Aye.
Okay. Unanimous.
Thank you, Carol.
My best to Nick when he can hear from us. I think the next one is the Contan Liquors tobacco violation hearing.
Okay. Should I start then?
Sure.
Please.
Okay, I apologize for not being on screen. I can't figure out how to get myself not sideways, so. Well, we're here because Content Liquors, the owner, who is Rahul, should be here if he's not already. Do you see him here? Yes? Okay. So from the tobacco program end, on June 23rd, 2024 at 2:34 p.m., an underage buyer was able to purchase a pack of Marlboro Gold cigarettes. I have them here in my hand. So that this buyer was under the age of 21. Therefore, the violation penalty is a $1,000 fine and a 3-day suspension of the permit to sell tobacco products.
This was a second violation?
No, first violation.
First. Okay.
Yes. Mr. Patel, are you here and do you want to speak? You're there you go.
Can you hear me?
Yes.
Yes.
Okay, thank you. So yes, thank you, Bonnie. With this violation, again, it's a first time that we've come across. So, primarily it's a liquor store. It's a, with cigarette sale. And, we're very stringent about checking the IDs, right? I mean, we do have like this app that we use for IntelliCheck. We have quite a few of these fake IDs that we come across. So, from that standpoint, we are very diligent. For this round, it seems it was on a Sunday afternoon. And again, I'm still, frankly speaking, I know which employees were there, but I'm just not sure of who who kind of did the violation, right, from an employee standpoint. Because again, I don't think the auditor or the inspector has not stopped by. And again, I'm not sure if that's the process or not, but that I found out when the letter came, which I think Bonnie was trying to explain to me earlier, which makes sense, where they want to keep the the undercover minor and not expose. But from a violation standpoint, absolutely. Meaning, we, like I said, we do take this seriously. Meaning, our employees are tip certified. We do have this, like I said, special app that we pay dearly for, and it's a first violation, cigarette or liquor, and at least, ever since, at least, we've taken over the store back in 2018. On the 3-day suspension, that is something that we have followed through, just because I was unsure. So again, I do have the report showing that we have not made any sale on those 3 days, August 12th through 14th. But more of the hearing, I wanted to discuss or bring up the $1,000 penalty, and that's something that I was hoping that as a first-time violation. And like I said, I do have so many fake IDs. I don't even know what to do with. Over time, we've just collected. We don't even give it back. And it's the guidance that we have given to the employees is anyone that is under 35 or even close to that. But since this violation, we're pretty much even increasing that age to just say anyone that seems roughly around that age, 35, 40, let's make sure we card them. So again, it is ongoing occurrence everywhere, I'm sure, with these type of violations. But like I said, this is very much a first one for us. But we do have, as I mentioned, proper measures in place with tip certification, more on the alcohol side, but it's the same 21 years, carding everyone, right? And also, like I said, this IntelliCheck software that we have for age verification. And and then the 3 days we have not sold the 3 days that were on the letter originally.
Okay. Thank you.
Thank you.
Bonnie, any additional comments before we process?
I'm sorry, say it again, Dr. Green.
Did you have any additional comments before we talk as a board?
No, but I did want to add, Mr. Patel, since January of 2020, the law now states that everyone must be asked for an ID to purchase tobacco products, regardless of what they look like. So that's a misunderstanding that I just want to correct before we go any further. It's the lawyers who work with us have told us that it's similar to the Fenway rule, which at Fenway Park, if you go to get a drink, you're asked for an ID, even if you look like an 80-year-old man. And if you go back to your seat and you come back a few minutes later, you're asked for an ID again. And the same is true now for any tobacco products. So just wanted you to know that, so that if you are advising your employees that they should look like they're over 35 or something like that, that's too subjective, to be able to figure out. And I think that's why the law changed, to make it so that everybody has to show an ID. Just an FYI.
No, I appreciate that input, Bonnie. And again, it is a business where, again, we do have a lot of repeat customers. So again, from that standpoint, we the employees kind of know who's coming regularly. We know the age, meaning an ID, and so on and so forth. But anyone, like I said, from a ID check, like I said, this checker that we have, it's more of a scanner, right? That we just scan the ID and it's a age verified, okay, and then it kind of gets this. So from your comments, feedback well taken, that it has to be everyone. Now I'm not sure, and apologies for not very clear on this, but meaning I'm not sure. I just don't want to say yes right now, and tomorrow another audit comes in and it's like, hey, you haven't checked for a 50-year-old or some, meaning it's just something that with the foot traffic and all, like I said, we do take this very seriously, meaning obviously this is not a candy store or something like that we just are taking it lightly. We take it very seriously. We make sure and licenses are passed out to make sure there is a big responsibility that's given to these owners, to owner like me, to say, hey, there is restrictions, there's prohibitions and so on and so forth, where the ID check needs to happen. So absolutely, point well taken, that yes, it shouldn't be just, I think it's roughly this age, and it should be, the carding should happen a lot more or should increase, yes.
Sorry, guys, I seem to have lost Wi-Fi for a second, but can you hear me now?
Yeah.
Yeah.
Okay. Um, okay. So I think my take on this is not an unusual occurrence that we've had this, and sort of, as Robert brought up the fairness principle before. I think we've been pretty consistent that we've pretty much imposed the legal fines when these cases come up.
Yes. Mhm.
So if there were a hurricane or a power outage and the machine wasn't working to check IDs, then I don't know, maybe there might be a time, but oversight of employees is a pretty common reason why this happens, and it's kind of the reason why we have the fines and do the tests. So
And that's where we have the tip certification, meaning message well taken, but like I said, the certification on the tips, which goes through the ID checks, right? Meaning we have so many of the, you
and
know.
I understand, but it either wasn't used or it wasn't working, in which case you need to do something about the tips. I don't know what to tell you about that, but if a miner was able to go in and get cigarettes and not have the tips checked, then that's an employee problem or it's an equipment problem.
Yeah. According to the youth, the clerk was on the phone. I told this to Mr. Patel earlier, so I'm sure the clerk was distracted and just handed the product to the young person.
Okay, and there's absolutely no way for me to find, meaning at least which employee. So at least if there is a correction or if there is that I need to do, meaning because by the time I found out about the ticket, the video recording and all kind of just cycles through and so on and so forth. So I have not the minor, meaning I totally respect the audit and all, but it's even internally, if I need to discipline, it's just I'm at a loss right now to even find that out. But anyways, that's something that I need to do, not just individuals, but across the board. It applies to all within my team. But it's just something that I still don't know who it was on that day, right? So anyways, it's a person on the phone. You mentioned Bonnie, and male, female, at least on the employee side, you're not able to disclose that.
Why don't we take this offline? And
okay. Okay. Yeah. No. Okay. So for
you guys may want to have that conversation. I don't know. I'm not going to speak for Bonnie, but we
okay.
So we need to move on. So I think we need to take a vote specifically about whether or not to make any adjustments to the violation. So I make a proposal to vote to enforce the violation as issued.
Yeah, I'm on board with that, Brian. I think we've been impartial, fair. This is how we always take it. It's like a strict liability issue, unless there's some resoundingly great reason that the ID check didn't happen properly. Yeah, I think we enforce the rules that we have. So,
All in favor?
I agree. Aye.
aye.
All right. Thank you very much.
Okay.
Youth services update, Kristen Berkowitz. Oh, Christina Berkowitz. There's a slight discrepancy between the agenda spelling of your name and the Zoom version of your name.
That's all right. It happens all the time. How are you guys doing? This is more intimate than I expected it to be. Let me see if I can get my screen up and sharing. I've got a little PowerPoint. So if y'all are familiar, the Youth Services team is a new division within the Health and Human Services Department within the city. So this is probably your first time hearing from us. Are you guys familiar with the work that we're doing at all so far?
I'm not.
All right, first time then. Sorry, I don't use Zoom that often, so it's taken me a second. There we go. Okay. Let's see. Do you guys see my full screen option? There it is.
Yes.
All right. So my name is Christina Bergquist. I'm the director of the Services Division within the Health and Human Services Division of the city. I want to introduce you to the other members of my team. We have Dan Harris, who's our Youth Services Coordinator, and Mia Juarez Farnsworth, who is our Youth Workplace Learning Coordinator. And Dan's been around for about a year. I've been around also for about a year, and Mia joined the team about 6 months ago. So we're rapidly growing effort within the city. And we're focused on promoting and fostering the development of resilient, prepared, and engaged Somerville teens so that they can thrive. Our work is broken up. The majority of our efforts are spent providing direct youth program facilitation right now. But as I've said, we're a new division of the city, so we spend a lot of our time also thinking about where we're headed, so focused on strategic planning, and then building on our existing relationships through partnership and collaboration. First, I'll talk about our direct program facilitation. The biggest program that we run by a long shot is the Mayor's Summer Jobs Program. This summer, we employed about 214. We had 214 jobs, and there was a little bit of turnover, so we were able to offer a few more than that. But we partner with about over 25 different sites across the city, mostly within city government and a few external, to host teens throughout the summer for a 6-week career readiness program. We have seen a lot of increased interest in this program in the last couple of years. We had over 400 applications, 382 were actually met all the requirements for the program. And that is significantly more than we had last year. We did our best to place them all, and we're also working really hard to figure out how we can grow and expand so that we can place as many Somerville teens as possible to keep them busy, employed, and giving them some meaningful work over the summer.
Paula. Uh-oh, Paula. Paula,
Uh-oh.
you were being seen on camera. Sorry.
We good?
Yeah.
Okay. So some of the things that we've
Actually,
done.
while there was a break, the
Yeah.
distinction between the applications accepted and then the number of people's interviewed, what's the
Oh, yeah.
for the interviews conducted, what's the step off between those two steps?
That actually is really common in youth employment and probably also in adult employment too. It's just the percent of teens that actually showed up for the interviews.
Yeah, okay, that's what it's
Yeah.
Thanks.
We did have a lot lower attrition in that step this year than we did last year, so that was really helpful. Because we had teens schedule their own interviews, so we did less overscheduling because teens who were not going to show up for the interviews didn't sign up for the interviews. So we saved a lot of staff time that way, and also gave teens a little bit more autonomy this year by having them schedule their own interviews. We gave them the opportunity this year to rank their first, second, and third placement preference. So we had more teens paired with positions that they were really excited about. We published a program-wide expectation manual so that supervisors and teens could be on the same page and speaking the same language about the work that they were doing and what the expectations were. And we also went through that in the training for site supervisors. So we made sure that all supervisors felt confident and comfortable going into the summer because their full-time job is not youth supervision. So we wanted to make sure that they got the training that they needed to be successful in that. We also piloted a youth orientation, which allowed teens to take a step back before the beginning of the summer and think about how they want to present themselves throughout the course of their position and go over those expectations with them. And we're also piloting something called youth employment cohorts. So instead of just sending them straight to their site, we tried out with our climate justice cohort, a new model where teens are working in groups Monday and Tuesday. They do group learning and projects all together, which gives them a focused team time and also incorporates more of the socio-emotional learning that is really important as part of a summer job. And then Wednesday through Friday, they're placed with different city departments and get a little bit more of autonomy, individual project time. So we're trying this out It was very successful this summer, and we're thinking about what other cohorts we can implement in the future to make it the most of youth time, but also staff time who are partnering with us on this program. We're also working to expand that offering into the school year. So we're reaching out to departments to figure out where placements might be a good fit for the school year, hoping to hire folks starting in about January into school year jobs for teens as well. In the school year, we also offer teen skills workshops. So this past year, we offered mental health and self-care, which we offered in partnership with the Human Services Division. We had a workshop on finding your first job, resume writing, and interviews, which we timed with the application process for the summer jobs program, but it was open to anyone who's applying for, or any teen who's applying for any job. And we also partner with the Council on Aging to provide a snow shoveling program. We match teens with seniors and people with disabilities so that they can shovel their driveway, their front steps or whatever. And it's a really good like mutual service. So we just do the matching portion of that, but I think it's pretty sweet. As far as strategic planning goes, we spend, I'd say last year we spent a lot more time doing internal work planning and relationship building. We also hired an external consultant to facilitate a formal needs assessment, and we're working on processing the next steps of that needs assessment now. And then in terms of partnership and collaboration, I sit on the Somerville Children's Cabinet, along with like the superintendents, folks from the school district, as well as staff from the city who can, talk about, bring up decisions and what they're hearing about from constituents. We also participate, today was the first after the summer, the Youth Worker Network. So those are meetings for direct youth workers to share their experiences, have shared trainings, and just keep each other in the loop on what's going on in the city. We also partner really closely with all of our HHS colleagues and also across the city, partnering with other city departments to host those over 20 different job sites that are city-based. And the last thing I'll mention is that we manage the grant with Teen Empowerment that's also through the city, which provides youth employment year-round to another 35 teens each year. Next, we're going to continue our reflection and work planning. Like I mentioned, we had that needs assessment. So we're going to be reviewing the outcomes of that and making our next steps based on it. Working on that pilot of a school year programming and gearing up for the snow shoveling and teen skills workshops. I have a couple of pictures of the teens from the summer. This is Michaela working at the library at a Goats and Giggles event. So it's like a petting zoo for library visitors. We have our external partners working with Groundwork Somerville through the Mayor's Summer Jobs Program, working with city staff and doing an environmental justice workshop. And then these were closer to home for me in my office. Ariana and Aiden were the youth services interns for the summer and planned an end of summer party for all the other interns. And we have Walter and Aiden on the Mystic River. They were part of our climate justice cohort, pulling invasive plants out of the Mystic River. So that's just a little snapshot of who we are, what we've been up to. Do you guys have any questions about that?
That's cool
Is
stuff.
someone cares?
Go ahead.
Oh, I was going to say, if someone cares about prevention under this too, is that their own identity still?
They're still run separately. Yeah, with the prevention team.
And when you say these are jobs, this is like minimum wage employment they get?
They get the Somerville living wage, which is currently $17.72. So higher than minimum wage.
Wow. That's great. And when they do the snow shoveling, you're coordinating, but the people whose houses they're shoveling are paying that, or?
Yeah, so the snow shoveling is not a direct employment program. It's just a matching program.
Yeah.
So we have like rates posted on the website, and then we pair the seniors with the teens, and then they take care of it. Like I imagine people did a long time ago. I'm from California,
Right.
so I didn't shovel anyone's driveway when I was a kid, but I imagine that's how it works.
You know, it snows in parts of California, just not all of it.
But most people in Massachusetts don't know that, so I don't mention.
I've been in some pretty big snowstorms in California. Not on the beach. Anyway, thank you very much. That's all good stuff.
Yeah, I think my only commentary is I'm happy to hear that you guys are doing this with the public health framework, the upstream like needs assessment. Love hearing that, because I think ad hoc planning and implementation just, yeah, I think isn't as like holistic as it could be without an informed sense of what's needed and how it can be tackled. So really glad you're doing that, and hopefully that kind of leads to better programming. So I have to ask, because I think it is probably on the minds, and it's been covered in media, the kind of, the issue with the library, I think, has gotten a bit of notice. Is that something that your team has been kind of involved with and facilitating, or is that more of like, a library issue? Just wanted to get a sense, because I imagine there is some overlap, with maybe what you're interested in or what you're trying to do.
Yeah, I mean, I meet regularly with the staff who work in the teen room at the library. There's a little group of us, the teen room at the library, the Parks and Rec staff, and youth services team get together regularly to talk about what we're doing. And I think the direct situation, my team has a lot less involvement in. And I think overall, there's, for everyone who's working with young people in Somerville, a sense that there's more we need to be doing. So I think, like you're saying, providing increased and consistent opportunities for teens is really important. And I'm excited that we now have our small team of people in youth services that can focus strategically long-term in a stable way about how we can better be meeting the needs of Somerville young people. And I think I'm ready to support the library however we can. But I also want to respect the autonomy of the work that they're doing there. So it's both.
Right. Yeah.
Could I add something, Christina and all? So I work, my title is the person at the Six City Tobacco Initiative, but I also work within the Office of Prevention. And both Lovely Heller and I have been talking recently about what to do about the young people who are hanging in front of the doors at the library. And what we started to do was we began by having Keith Johnson, the person in the city who can map out areas, give us a map that shows where 50 feet from the doorway would be. And the significance of that is that we were hoping that we could set up some sort of a place for young people to just be together. And, if they're vaping, of course, we don't want them to do that. But if they are, at least they wouldn't be doing it right at the door as other young people are trying to go in. So our next step is to get in touch with Kathy at the library. And it seems like it's something we could collaborate on too, Christina, to see what we can do up there. Lovely possibly has some grant money that could help with us setting up some kind of a outdoor hangout area, if you will. So we're on that. I'll be in touch with you, so maybe we can work together.
Yeah, and I know that it's close to home with you guys because you are based at the library. So I think it makes a lot of sense for you to really like take up the space that you're running programs out of.
Right.
And yeah, be in touch with the library because I know that they're eager for help. So
Okay.
All right, thank you.
Thank you, Christina. Great work.
Great work.
Thanks, Christina.
It looks like the next thing on the agenda is Nicholas again, but I guess we'll punt that to next month.
I did speak to Nick before, so through the chair, I can just give a quick one thing that he wanted you to know was that their ISD has been helpful in exploring locations and working with us around the requirements for a winter warming center. They were helpful last year, and so they're part of our task force that's sort of implementing recommendations from last year, looking for ways we can improve the process, communication, as well as some of the sanitary code processes and procedures. So Nick and his team have been very helpful with that. I also pulled out there, or we have in your packet, there is the Q2 data for the health inspections, ISD, as well as their other inspections, but their activities, they're not just inspections, and kind of had a look back to Q1 back in the winter of 2025, so January, February, March. They have had a significant increase in the workload over these more recent quarter, and predominantly in things like application intakes, various types of applications, a big increase in wage theft review, which doesn't fall so much under the health and housing codes and regulations that you guys support, but it's an interesting issue for his team and their capacity. And I'm not sure what that's about. So maybe when he comes back next month, we can ask him to talk to us about that. Also a large increase in the number of FOG reviews. So this is the fats, oils, and grease requirements, changes to the food code. So I imagine this is, they did a number of months and a couple of years of preparing businesses, training. So I imagine they're now in more carrying out these inspections and re-inspections. So a lot more activity there, and a significant increase in their rodent program visits, which I guess would be expected based on the seasonal timing of April, May, June. But again, I would let the experts speak to that next month. So that's kind of the main things that ISD has shared with us for this past quarter, or a couple of months since we've met. Do you want me to keep going into my report, or would you like to?
Please. Yeah.
Okay.
Okay.
Thank you. So Health and Human Services, it's been a busy time as always. We kind of think the summer will be quiet, but it's not usually. So just again, all this information is in your packet. Wanted to highlight a couple of things. April, May, June, which is not typically a big COVID flu vaccinating time. Our public health nursing office held 39 vaccination clinics of sorts, and that was some chicken pox, Hep B, MMR, polio, Tdap, other things that are required for our K-12 students to begin school enrollment. So again, this is a new initiative that we've seen with our public health nurses working with our school nurses to ensure vaccines are regularly available. So as families or folks move into the community, they're not having to wait to enroll in school till they can either get an appointment with a provider, which I think we've talked about in previous meetings. It can take quite some time, months, to get appointments for some folks. So this is exciting, and right now they're shifting gear more into their seasonal flu and COVID clinics. So I'm sure we'll see those numbers go up as well. Our community health workers, I just wanted to kind of highlight that group, and they'll come back and give you a presentation at some point. The community health worker division is a new division in HHS as of about a year ago. It was funded. We now have 3 full-time community health workers, and we are working on a grant-funded 4th community health worker who will be a clinical community health worker. So they will assist at clinics and other clinical settings. That's a part of a regional grant with Cambridge and I believe Arlington. So that's an exciting program that we'll hear more about. But in the meantime, the 3 CHWs we have are up and running. They have procedures, policies, tools. They've been assisting us in distributing harm reduction materials. In the warm extreme heat, we were able to distribute some heat safety kits, some water, hydration tablets, things like that. They will also assist in the winter months. And they've been heavily involved with the sort of huddle team that meets within the city when there are issues around persons experiencing homelessness or some of the recent encampment concerns that you may have heard about or seen in the community. So these are really frontline boots on the ground. They are outreach folks who complement the other existing outreach teams in our community doing this targeted work to some of our most vulnerable members of our society. So we're thrilled that that program's up and going. They're doing a lot of Narcan distribution, Narcan training, test strips, fentanyl test strips distribution as well. Also partnering with Fenway, who we have an ongoing contract, but really making sure that Fenway is going to the spots that we really need them to. And then that team, the harm reduction CHW team, kind of complements it by being there different days of the week to ensure that there's services more than the 1 day a week. Our LGBTQ plus services held a successful Pride flag raising, as well as the big gay dance party earlier in the summer. And the division is also continuing to guide and support the City of Somerville Trans Support Task Force, which is a task force across multiple departments. And I'm pleased to say we have just gone out to bid for a vendor to host some trainings, some citywide sensitivity trainings for our staff. So, and that will be for all staff, all shifts. So a huge lift there, but we're really thrilled that that's underway. The Office of Food Access and Healthy Communities has provided in the Q2, provided almost 3,500 taxi rides to health and over 700 meals, heat and eat ready meals. Some of the work that they are doing, as well as with the youth food access, is ARPA funded. So there's a lot of discussion with our team, the administration, and really just kind of planning around how do we sunset these programs that they're not really able to be funded with operational city tax dollars. And they were a huge benefit to so many families during the years we had the ARPA funding for these programs. But so Lisa Robinson, our director there, has spent a lot of time with her team putting together plans and sort of continuity options for people, communicating to people other alternatives. And yeah, that's been a big project, and I imagine will continue through the year. Our senior taxi program is continuing with some funding, and that's for mainly routine medical visits for seniors. Our prevention unit, I think I mentioned, there were a total of 300 Narcan distributions, which is a huge effort. They did a great job with getting Narcan saturated into our communities, and over 100 trainings a month on average. We had a successful Memorial Day parade back in May. That seems a long time ago. Also, a lot of information from Connor, who's on the call, our communications officer, helps with messaging and outreach around extreme heat, safety in extreme heat for targeted groups who are at risk, and then learning more about tick and mosquito-related diseases, which I'm sure you've also noticed is in the news a lot as concerns grow for tick and mosquito-borne diseases. I talked about our regional nursing program, and then our summer promise had their multilingual Somerville summer camp guide that they produced. Again, I think this is a great example of where Summer Promise and some of our departments are collaborating and pulling together all of the work of multiple departments and helping to communicate it, identify gaps, and fill those gaps. And that's a lot of the work Christina talked about in the needs assessment that Christina and her team conducted. We find these sort of pockets where our teams are filling in. So that was a great help this summer. We talked about the mayor's summer jobs program, so I won't carry on about that. Our council on aging is also now able to provide some durable medical equipment at no cost to Somerville residents. So they have a number of items stored and have been able to offer that to residents. So those are a few highlights. I think in terms of priorities and initiatives right now on my plate, we are busily preparing for a winter warming center. We also have additional challenges that we did not have last year around insufficient family housing for families who are experiencing homelessness. Last year we didn't have great options, but we had more options, and the family shelter system was still taking families in. So this year we are really beginning to grapple with how can we support families that are arriving and showing up at our partner agencies and in our community who are experiencing homelessness. So it's a big concern. We again have this Friday morning huddle with lots of our city departments, but as well as some of the homeless coalition. We're sort of the lead agency in this space. But as you know, they don't work with children and families. They are predominantly funded and work with adults experiencing homelessness. So our city departments and our Office of Housing Stability are really scrambling and working very, very hard to help fill those gaps and do what we can for families. So that's a big challenge I anticipate will continue through our winter months at least. And yeah, I think those are some of the main initiatives. I also wanted to take a minute to highlight that this is the final board meeting of two of our longstanding dedicated board members who I have had the pleasure of working with for a couple of years now. And I'd like to read a citation that was granted by the mayor to both of you, and these will be a signed copy will be sent to your home address. Citation, be it hereby known to all that Her Honor the Mayor wishes to acknowledge Paula Mercado in recognition of her 17 years of dedicated service on the Somerville Board of Health. During her tenure, she worked on tobacco policy and guided our community during the unprecedented COVID-19 pandemic. Her work to protect the public health of our community will have lasting impacts for many years to come. Her Honor the Mayor extends her deepest gratitude given this 19th day of September 2024 by Tatiana Valentine, Mayor, City of Somerville. Paula, thank you. Second citation. Did you want to say something? Or,
Oh, I could say it after. It's okay. I started earlier. I'll let you continue.
Citation, be it hereby known to all that Her Honor the Mayor wishes to acknowledge Robert McQueen in recognition of his 7 years of dedicated service in the Somerville Board of Health. During his tenure, he worked on tobacco policy, guided our community during the 7 years of dedicated service. He guided our community during the unprecedented COVID-19 pandemic. His work to protect the public health of our community will have lasting impacts for many years to come. Her Honor the Mayor extends her deepest gratitude given this 19th day of September 2024 by Tatiana Valentine, Mayor, City of Somerville. Thank you, Robert, for your service, and Paula. Next month, we will be joined by two new board members, Alyssa DuBois and Margaret Hoyt. We are excited to have them on board from their fresh perspective, but we are very grateful for your hard work and all that you've brought to the city.
Thank you, Karen. Yeah, 7 years flies by. I still remember interviewing with Brian and Doug. Yeah, and the city annex, going through the interview, and I was like, I did okay. I probably won't get the offer. And then a week later, getting an email from Doug with the congratulations, and since then it's been a great ride. It's it's so nice to have this position, you know, where I can use my you know, law background, my experience in the state, my public health degree, and then, you know, kind of talk with my fellow board members, you, Karen, as well as your predecessor, Doug, and then I think most importantly, your staff. You know, I mean, we really are nothing without the great team at HHS and ISD. You know, we're here, we show up a couple of hours a month, but they're in and day out doing great work, and we're just they're cheerleaders and helping them out and trying to be as supportive as possible. And if along the way we make some good public health decisions, that's a nice outcome as well. So thank you guys. I'll miss this. I'll still be looking you know, for updates around the city, and yeah, continue the good work.
I also want to thank you. I know I started earlier when you weren't here, Robert. Back in 2007, it's probably my early years on prior to me getting into the grind of nursing. And it was back then when SCAP happened. There was a huge Oxycontin epidemic was big. Tobacco control started that we were a big part of that meant a lot to me, hit close home to me. The flavored, you know, the menthol control across the board, where people even put their efforts in, went over the board into New Hampshire. It's just, there was a lot, the oils, the trans oils, the rats. I remember that community meeting. That was interesting to say the least. So many, I mean, 17 years, it's probably, I'm going to say, because I've hopped around different hospitals, my longest, I'm going to say job that I hold and very proud of, and moving to this country and being part of so many different, from public health to healthcare to, which all contributes to this, to, you know, I see a lot of immigrants attending these meetings that aren't aware of policies and what the importance is in our city, because in the other countries, things are just they're more flexible, to say it in a simple way. So it's really nice to see the broad spectrum of different policies and how far we become. And yeah, that's really it. I'll definitely miss it. I'll definitely be a part of it still in some way, shape, or form. Who knows where I'll end up? Maybe I'll help the nurses out, but I'm a Brigham nurse. I'll be there for a while. I'm in oncology, but I've cut my hours down. I'll be going hopefully to Dana-Farber and seeing what else I can do, going back into public health. And yeah, it's been a pleasure with you all. I feel like it's Brian, you and I have been the longest. I feel like going back to Paulette. Was she our first director?
Not my first director, but yes.
My first director. That's what I mean. Yeah, I was trying to go back to like all the different people we've crossed paths with. It's been wild. It's been a wild road, especially. I mean, I know COVID was only 4 years ago, but that was probably the most intense, to say the least. But yeah.
Well, I was gonna say two things. One is, I mean, Paula, you and I have been through just an incredible transition of years.
I mean, we gotta, keep it X-rated, but horrible. I mean, yeah, it's incredible.
An amazing bit of issues, and I appreciate all you've done throughout the years.
Yeah, and I know I was very headstrong with COVID, very, very, people got the personality in me they probably didn't see, especially you, Ryan, but, it was hard for me. You know, I'm an oncology nurse with 30 beds, and we got converted in the middle of our shift to, "Hey, you're COVID only, learn it." You know, we had a little ICU, how to use these respiratory stuff, in the middle of our nursing station. We still talk about it, you know. So just everything just hit, and I loved it. I was so proud of it. But then when it just got to the nitty gritty and towards the end, I had it. And I just wanted to be alive again, and just everyone to be, you know, gone. Yeah, that was
all good. I was gonna say is that for me, one of the things that you've always been on this board as a voice for the immigrant community, and you've been talking about the population you added, and like your softball team and the stories
Oh,
about all that.
yeah.
Like,
Well, that
totally
was huge because
helpful.
my uncle had overdosed, so I held and turned into a positive, and I for 10 years I hosted a softball tournament and contributed actually to end up being some because of a prevention, but they took it back to Corey back in the day. Remember Corey?
Yeah.
And he towards to put it towards tobacco, which was great. It's all part of it, right? But yeah, no, I love just any little hand makes a difference, right? But yeah, no, it's been wild. It's been in a good way, in a good way.
And for you, Robert, like you come in with the ability to speak government in a way that like blows my mind. And, we're listening to presentations, you're like, yeah, that's a good thing. And how does it interface with the policy that came down? And like, I don't know, man. I really appreciate your perspective and what you brought in, and I really feel like both of you have helped make this board a tremendous
Thank you, Brian.
success.
I'm glad I could add the merciless bureaucrat perspective to this board that it's sorely needed. So.
And the other thing for those of you who aren't as in, maybe you are, but the public hearing laws are very explicit. So I feel like for both of you guys, we've known each other a really long time, but every time we have a conversation, it's under the watchful eye of the public. We're not allowed to email, we're not allowed to talk. If I run into you guys in the supermarket, we're not allowed to talk. So I'm kind of hoping that one of these days now I'll be able to be like, so tell me about yourself. Anyway,
Yes, been
thanks a
a
lot.
ride, but a good one. Yes.
And thank you, Karen. I'm sure it wasn't easy coming on board either. Not easy, but someone's come a long way.
It's always an adjustment, but this particular board has been an absolute pleasure to work with. You challenge us, you challenge the team, and you're thoughtful, and it's been a pleasure. And Brian, you're still stuck with us.
Yeah, well, that's the next item on the agenda is next meeting. So, yes, I'll be there.
Maybe I'll just join and be one of the participants,
please.
attendees if I'm not working.
Yeah.
And always, that's right. And the nurses definitely need volunteers. So
I know. It's funny. I mean, we could talk more, so I don't hold up it's every year I used to volunteer to administer the flu, but they never needed it and still don't. But because Monica was the nurse there, I graduated with her son actually. And like anytime she's like, no, we're always good. I was like, oh, okay. But yeah. But you have my email and contact info. Let me know.
All right. Well, 7:20. I make a motion to adjourn.
I second it. Good luck, everybody. I'm sure don't be surprised if I'm one of the attendees one of these days, depending the topics. Great to see you guys.
Yeah.
Good luck, everyone. Take care.
We're working with you guys.
Bye.
Okay.
Bye, Bonnie.